You always want to use the 6 rights of medication administration. So you want to have the right patient with the right medication, the right route, the right time, the right dose, and the right documentation. So we're going to knock on the door to introduce ourselves. Hi, I'm Abby. I'm going to be your student nurse today. Always want to do the standard precautions, so you want to wash your hands, check for patient safety, make sure they have their colite, they're not falling on the floor, there's nothing on the floor that they could trip over or step on, things like that. Ensure privacy, so shut the door. You want to check their allergies in the medication administration record. Always make sure you have the correct body mechanics. So we're looking at our MAR, and it says saline lock after second liter of 0.9 normal saline. So pretend this bag is empty. That's all done. So we're going to have to do a saline lock. First thing I want to do is the 2 patient identifiers. So check the wristband, ask them their last name and date of birth. Compare it to your MAR, make sure you have the right person there. You're going to wash your hands. You're going to look at this IV site. Make sure there's no inflammation, redness, pain. Make sure that that is all good there. And then we're going to, since we taped it up earlier, we're going to have to remove that tape. So washed our hands. Put some gloves on. Before, touching anything around the IV, put some gloves on. We're going to remove that tape that we put on. And then we're going to expose the hub. So we're not removing the clear dressing. We're just removing the tape. So we can see the IV hub. Everything looks good. So we are going to remove the IV tubing. Before that, we would have clamped it before we removed it. In this case, there's a little bit left. Didn't want that running everywhere. Okay, so you have this here. You have your supplies. So you have some alcohol swabs and you have a saline flush. So you're going to clean the site here with the alcohol swab. Allow for time to dry, and while that's drying, you can open up your flush, take your cap off. Make sure that you get all the air out of the top, and there's, whoops, a little bit of water that comes out, so you got all the air out. Okay, then you're going to flush. You're going to connect it, twist it, and you're going to flush 5 milliliters. And obviously if there's some resistance or you see fluid above where the site is, you'd stop. You'd have to recheck the patency of your IV. Okay. So then you're going to remove your saline after you successfully had 5 milliliters. And then you can clean the site again. You're going to explain to them, so it's saline locked, it's going to stay like that. You're not going to have anything running through it for now. We're going to keep it in just in case you need fluids or antibiotics or something later. So explain to them, not to get it wet. Be careful of hitting it on things. Make sure that the dressing is still on there, okay, so it doesn't fall out. And then you're going to document on your in your chart that you flushed it with 5 mils, saline locked, IV site looks good. Ask them if they have any questions. Give them their call light. And So we're checking the medication administration record for our patient, IV needed. There is an order to give dilaudid 2 milligrams Ivsp every 2 hours as needed for complaint of pain related to coughing. The dilaudid label states that dilaudid 2 milligrams per milliliter and dilute with 2 milliliters normal saline for IV administration. Give dilaudid 1 milligram every 2 minutes per Ivsp. So we checked our order. When we're administering our medications, we're going to do the 3-check method. So always make sure you have the right patient, the right medication, the right route, the right dose, the right time, and the right documentation. So we checked all that. We're going to do that 3 times. So the first time, you're looking at the order, checking for the right patient. When you're getting the medication out and prepared, and then a 3rd time at the patient's bedside. So we're going to do some math here. 2 milligrams per 1 milliliter. So you're going to have 1 milliliter out of here, and then you're going to dilute with 2 milligrams normal saline. So that's going to end up to be 3 milliliters, and you need to give it over 2 minutes, so that's going to be 1.5 milliliters per minute when you're going to administer it. When you're getting your medication, you want to check the expiration dates, look for any cracks, particulates, any weird discoloration, anything like that. So these all look good. We're ready to get our medication ready. We're going to clean the top of the dilaudid, clean the top of the normal saline. Then we're going to get our needle out to drop medication. So I'll make sure that's working there. Gonna click that in, open this up. Okay. So the first thing we need to draw up is the dilaudid, 1 milliliter. So we're gonna drop air, 1 milliliter. We are going to insert through the top, put the air in, flip it upside down. We're going to draw out 1 milliliter, making sure we don't have any bubbles or anything in there. Okay, so we have 1 milliliter here. Then we're going to inject that into the normal saline. Okay, and so then that is all mixed together. And then we need to take out 3 milliliters of this solution. Kind of roll it a little bit, mix it up, and then gonna flip it upside down, take out the 3 milliliters. Okay. No, just a double check. 3 milliliters. We can cap this needle here because we won't need the top of the needle anymore. So we can actually just set it inside here because it's still clean. We can set it, on the patient's table. We're going to knock on their door, introduce ourselves again, hand hygiene, 2 patient identifiers, last name, date of birth, at their wristband. We're going to tell them what we're doing. So we have an order for the dilaudid. Assess their pain right now, since that's what the dilaudid is for. Before we put anything into the IV, we're going to check the patency of it. Make sure there's no inflammation, redness, they don't have pain at the site. Still intact and they're okay. So that all looks good. Gonna clean that port there. And then we're gonna do 5 milliliters of a saline flush. Open this, take the cap off, get all the air out of the top. Okay. Then we're good to put it in, twist that in, give the 5 milliliters. While we're doing that, making sure there's no resistance, no pain, and it's going in the vein okay. And then we will take it out once we got 5 milliliters in there. We're going to clean that port again, and then we are ready to give them their medication at their determined rate of administration. So we can take the needle part off here and put it into the sharps container so you don't need the needle anymore. So you already cleaned the port here. You checked for, any tenderness, pain, redness, swelling. That all looked good. So you're going to administer your medication. We have the 3 milliliters. It needs to go over 2 minutes. So 1.5 milliliters per minute. Going to twist it in. And so while we're slowly infusing it over that time, we're going to monitor for adverse reactions. Make sure the IV is still in there okay. There's no problems with the IV. So after that's the amount of time, 1.5 milliliters per 1 minute. And we get all the 3 milliliters in. So 2 minutes altogether after that's all in. We are going to remove our medication syringe. We're going to clean the port again. And then we're going to flush again with 5 milliliters of the saline. Okay, make sure you have all the air out. And this was already cleaned. Put this in and do the 5 milliliters. And while you're doing that, make sure no pain, redness or swelling, no resistance while pushing this in. You will take it out after you put in the 5 milliliters. You're going to put away all your equipment, so the needles and the sharp spin. Throw away all your garbage, get that out of the way. You can clean the port again after you're done using it. And then you're going to document that you gave the medication, that they tolerated it well, that the IV site looked good, no complaints there. And then make sure that you go back and reassess their pain. Leave them with their call light, ask them if they have any questions. Make sure they're safe. So it looks like there's an order to discontinue the IV infusion after the last dose of chlorphorin. So we're going to get our equipment ready. We're going to get some gauze pads, sterile dressings, some Coban. We're going to open this up so that's ready. Open the gauze up so it's ready. While we're doing that, we're going to explain to them that it's time to take out the IV. So we have that ready there. Going to put on some clean gloves. Put on some clean gloves. We're going to hold the hub and the catheter in while we remove the transparent dressing. Okay. We're going to get the gauze ready because we're going to remove the catheter from the vein and quickly and firmly apply pressure. Okay, so we're going to apply pressure for 2 to 3 minutes. We're going to check this for the intactness of it, make sure that a piece of it didn't chip off or break off. And then after we've done that, I'm going to put it in the sharps container. If they're on like blood thinners, Coumadin, we're going to have to hold pressure for a little bit longer. You know, assess the site. Make sure there's no like redness, tenderness, swelling right there. And we can put on a sterile dressing or like another gauze pad with some Coban over it. We're going to discard of everything appropriately. And we're going to document that we took out the IV, the site looked good, no pain, redness, swelling, patient tolerated it well. And then make sure that we have everything charted.